X-ray beam is tangential to the interface of two structures with different radiographic densities. Two distinct structures will be visible. An example would be the right heart border, which is visible because it has a different radiographic density to the adjacent aerated right middle lobe. This is to illustrate that when the X-ray beam from a point source diverges and projects onto the heart tangentially, we can make out the right and left heart borders against the lungs because they have different radiographic densities. This is a normal chest X-ray. You can see the blood vessels in the lung because, again, they have a different radiographic density to the surrounding lung tissue. To recap, normal aerated lungs have a different radiographic density to the adjacent structures, which is why we can see the outlines of those structures. They will no longer be visible when there's consolidation or collapse, and this is a silhouette sign. And usually the first sign of consolidation is the inability to visualize blood vessels in the lung. On this chest X-ray, the right heart border is hazy. This is due to collapse of the adjacent right middle lobe. On the lateral film, we can see an opacity between the horizontal and oblique fissures against the cardiac silhouette, which is the collapsed right middle lobe. On this chest X-ray, the right hemidiaphragm is obliterated due to consolidation of the adjacent right lower lobe. We can also see the right heart border because the pathology is not within the right middle lobe. On the lateral view, we can see the left hemidiaphragm blending into the cardiac silhouette as they have the same radiographic densities, but the right hemidiaphragm is not visible because it now has the same radiographic density as the right lower lobe due to consolidation. We can also see the oblique fissure and increased opacity in the right lower lobe. Air bronchogram is the outline of a patent air-filled bronchus against consolidation in the surrounding lung tissue. Clinically, bronchial breathing is heard on auscultation. This chest X-ray perfectly demonstrates air bronchogram against consolidation in the lung. To summarize, structures of different radiographic densities that lie adjacent to each other can be seen separately. When the air spaces opacify, the silhouette is lost between the lung and the adjacent structures, but is created between the consolidated lung and air-filled bronchi. This is known as the silhouette sign. Here we have an example of the silhouette sign in real life. The skyscraper is visible until it disappears into the clouds. This is very similar to a blood vessel in the lung which can no longer be seen due to consolidation in the lung, as they now have the same radiographic density. On this X-ray, we can also see the horizontal fissure and an air bronchogram. This is right upper lobe consolidation.